Hello, thanks for joining us today. My name is Mark Hammerberg. I'm one of the orthopedic surgeons here at Denver Health, and the topic of our discussion is going to be knee replacement surgery. We'll talk about what knee replacement surgery is, who can benefit from it, and we'll just go over the basics of how it gets done here at Denver Health. So right off the bat, just to sort of zero in on what the knee is, I think we all know what the knee is, but I'm going to pull in the skeleton. And just for reference, we've got a lot of bones, but the bones that concern us for the knee are about three. We've got the thigh bone, which is the femur. We have the shin bone, called the tibia, and then we have the kneecap bone, called the patella. And where those bones come together, that's what we call the knee joint, where the thigh bone is connected to the leg bone. So, I have a smaller model. It's just a knee that's going to be easier for us to focus on. So here's a knee. It's not everything there is to a knee, but it is the bony structures. It shows us the femur, the tibia, the kneecap, and if we look inside it, we can see where our cartilage is. Cartilage, if you're familiar with eating chicken wing or other joint, that's where the bone comes together at the joint, and it's coated with a glistening tissue called cartilage. This isn't very glistening, but the cartilage is what allows smooth motion of the knee joint. What is a knee replacement? Some people have the idea, and it's reasonable that they might have this idea that a knee replacement, well, what we're going to do is we're going to go and we're going to cut the thigh bone here, we're going to cut the leg bone here, we're going to remove the knee, and we're going to put in an artificial robot knee with hinges and bells and whistles. That's really not what a knee replacement is. A knee replacement you can think of as a cartilage replacement. What we are doing is we're cutting out the cartilage which lines the joint, and we're replacing the cartilage with artificial parts, basically metal and plastic parts. What does that look like? Here's a knee that's not replaced. This is a model of a knee that has been replaced, and the parts are already in it. To show you how we put the parts in though, I'm going to take these parts out. When we do the surgery, we make an incision. We move the kneecap over. Obviously, the incision's going through the skin, fatty tissue, muscular tissue, and we make an incision on the side of the kneecap, and it allows us to move the kneecap over, and when we bend the knee, of course that ligament stays there. When we bend the knee, we can see inside the knee joint. And we basically, when we start a knee replacement, the knee looks something like this. How do we get it to look like this? We start by cutting the cartilage out. And much like peeling a potato, when you peel a potato, you don't just remove the peel, you remove a little bit of potato with every portion of peel. So when we remove the cartilage, we remove a little bit of the bone. And we remove it by making precise saw cuts. When we're done making the cuts, the femur bone looks like this. It's kind of like an octagonal or stop sign looking configuration, where we remove not only the cartilage, but a little bit of the underlying bone. Similarly, on the top of the tibia, we make a flat cut, we remove all of the worn out cartilage, and now we just have a flat bony surface. Here comes the replacement. Remember, it's not replacing the whole knee, it's just replacing the cartilage. So the artificial cartilage takes the form of a piece of metal that is now attached to the end of the femur, much like a crown on a tooth, but it's a very big tooth and a very big crown, but it's your cartilage replacement. It's a piece of metal. The cartilage replacement on the tibia is another piece of metal. As I put that metal down, you'll notice that there's a piece of plastic. That plastic now forms the new articulation where the joint comes together. So instead of worn out cartilage, which hurts and is painful and doesn't let you get very far, we now have a restored, it's a replaced knee joint with artificial cartilage, and the artificial cartilage takes the form of metal and plastic. And where that metal meets the plastic, that now allows for a smooth motion of the knee. You notice that the underside of the kneecap also has cartilage which we remove, and we replace that cartilage with some more artificial plastic coating for the back of the kneecap. And that's a total knee. Why do we do a knee replacement? Basically, we do it There's a lot of diagnoses, or there's different words that we use to explain why we do a knee replacement. Ultimately, the reason for a knee replacement is worn out cartilage. A name for worn out cartilage is arthritis, means inflammation of the joint. The body's response to the wear and tear and the aging of cartilage is that it cannot heal the cartilage. It tries to heal it, but it just results in inflammation, meaning the inside of your knee joint is inflamed. What is inflammation? It's red, it's swollen, it's tender, and it doesn't function well. You can think of arthritis like a sunburn on the inside of your knee. Arth, Greek for joint, itis, Greek for inflammation. So just like a sunburn is red, swollen, painful, tender, the inside of your knee, if you have arthritis, is red, swollen, painful, tender. The cure is get rid of the worn out cartilage because it cannot heal itself, and we replace it with artificial metal and plastic. About 80% of the United States population will go on to have some form of knee arthritis. Who needs a knee replacement? The people who need a knee replacement are people with knee arthritis who have tried everything else, and still their knee arthritis is a major impediment to their daily life. Their knee arthritis gets in the way of their daily function. It prevents them from doing the things that they need to do to make their life complete. We all define that as different. Maybe some people define a complete life as being able to ski a couple ski runs. Maybe people define a complete life as being able to walk 18 holes at a golf course. Maybe some people define a complete life as being able to run around after your grandkids and not just sit in one place. For whoever you are, you have an idea of what it means to have a complete life and what you require of your knee to be able to live it. What are the things that you can try that are not surgery? I think you know of a lot of them. We always recommend weight loss. We always recommend regular low impact aerobic fitness. Both of those things have been shown to decrease knee arthritis pain for people who have it. And they kind of go hand in hand. But it turns out that even if you don't lose weight, the simple participation in a regular low impact aerobic fitness routine has been shown to decrease knee arthritis pain, whether you lose weight or not. And independently, weight loss itself has been shown to decrease knee arthritis pain. So why not work on both of those things simultaneously? When that's not enough, we all know about ibuprofen, Advil, naproxen, Aleve. These are over-the-counter, non-steroidal, anti-inflammatory medications. They can also come in prescription strength, but these are the kind of medications that work for knee arthritis. They're very safe medications, but if you're taking these medications on a daily basis, you should really do so in consultation with your primary physician so that you don't run into any problems such as potential side effects or drug interactions. I've known people who've been on the maximum dose of ibuprofen for multiple decades and they've lived to tell the tale. So it is safe, but you must do so cautiously. Another medicine that works is acetaminophen or Tylenol. Again, if you take any medicine regularly, you should do so in consultation with your primary physician. So now here you are, you've been taking ibuprofen or some other non-steroidal anti-inflammatory medication, and you wonder, well, this is fine, but is there anything else I can do? Is there any other way for me to get more out of my knee, get more out of my life? Well, yes. One good suggestion would be come see one of us here at Denver Health in the Department of Orthopedic Surgery. We'd be happy to see you, examine your knee, evaluate what you have been doing for your knee, talk about other things you might do, talk about surgery. We can also talk about ways to avoid surgery. One thing that is short of surgery that you might like to consider is having a knee injection. You can have multiple different kinds of injections. I often recommend steroid injections, and if these work, they can be repeated. But there are other types of injections that can be provided for knee arthritis, and it's between each individual patient and his or her physician as to what may or may not be the right injection for them, if any at all. Steroid injections can provide several months of relief, and if they work, they can be repeated. If they don't work, there's no sense repeating them. But many patients go for many, many years. They might ultimately need to have a knee replacement, and steroid injections can help delay the time at which a knee replacement is done. And for some people, they never even move on to a knee replacement. But many people, the steroid injections stop working, their effect wears off, and now the choice is, do I go ahead with the next step? And for all intents and purposes, the next step is often knee replacement surgery. So we've talked about knee replacement, but we haven't talked about how great it is to get a knee replacement performed here at Denver Health. We have top-notch surgeons, we have top-notch therapists, we have top-notch anesthesiologists, and we're all operating at the forefront of our technology. You may have heard of same-day total joint replacement. Well, that's the way we do it here. You may have heard of opioid-sparing total joint replacement. That's the way we do it here. We use multimodal anesthetic protocols involving spinal blocks, peripheral nerve blocks, all in an effort to minimize the effects of anesthesia, get you going faster, leaving the hospital early, and in most cases, people go home on the day of surgery.